Imagine this. A silent yet growing threat is sweeping across California, leaving thousands sick and vulnerable. It's not a new virus or bacteria. It's valley fever, a fungal disease that's becoming increasingly common in the state. Public health officials are sounding the alarm after a record-breaking year in 2024, warning that the risk remains dangerously high as we move through 2025. Valley fever is here to stay in California, emphasized Dr. Erica Pan, State Public Health Officer and Director of the California Department of Public Health, in an August 14 news release. We want Californians, visitors, and healthcare providers to remain vigilant about recognizing its symptoms early. And with over 5,500 cases already reported statewide just this year, it's clear why awareness matters more than ever. But here's where it gets alarming. In 2024 alone, nearly 12,500 cases were documented, the highest number on record. Compare that to previous years, 2017 to 2023, when annual case counts ranged between 7,000 and 9,000. Not only are numbers climbing, but the geographic spread is expanding too. While southern San Joaquin Valley has historically been ground zero for valley fever outbreaks, other regions like the Central Valley and Central Coast are now seeing significant upticks in infections. So what exactly is valley fever? Also known as coccidioidomycosis, this illness stems from a fungus found naturally in soil across parts of California and the southwestern U.S. When people inhale dust containing spores of this fungus, they can become infected. The result? Symptoms that mimic those of COVID-19 or the flu, including persistent coughing, fever, chest pain, and overwhelming fatigue. Who should be most concerned? If you live, work, study, or even travel within areas heavily affected by valley fever, you're at risk. Counties such as Kern, Kings, San Luis Obispo, Fresno, Tulare, Madera, and Monterey see some of the highest infection rates. But beyond geography, certain groups face elevated risks due to underlying health conditions or demographics. For instance, individuals living with HIV/AIDS, organ transplant recipients, pregnant women, diabetics, and seniors over age 60 are particularly susceptible. Additionally, studies suggest Black and Filipino populations may experience higher infection rates compared to others. And this is the part many overlook. Despite how serious it sounds, valley fever isn't contagious. You won't catch it from another person or your pet. However, there are rare exceptions. Transmission via an open wound or during an organ transplant involving an infected donor could theoretically occur. Pets, especially dogs, aren't immune either. While they can contract valley fever, humans cannot get it from their furry companions. Given the challenges in preventing exposure entirely, reducing risk becomes key. Unfortunately, no vaccine currently exists, though scientists are actively researching one. Until then, practical steps can help minimize chances of infection. Avoid dusty environments like construction zones, wear a properly fitted N95 mask outdoors, and consider limiting activities involving direct contact with soil, like gardening. Keeping indoor air clean with filters and promptly cleaning any cuts or abrasions also makes a difference. For those at heightened risk, doctors might prescribe antifungal medications as a preventive measure. With all these complexities surrounding valley fever, it raises important questions worth discussing. Should public education campaigns ramp up sooner rather than later? How much responsibility falls on local governments versus individuals to mitigate exposure? And can future research unlock better solutions for prevention and treatment? If you're curious about life in California or have burning questions about state laws, history, culture, recreation, or travel, don't hesitate to reach out. Our team at How to California is dedicated to helping residents and visitors alike navigate the Golden State's unique landscape. Submit your inquiries using our online form or email us directly at howtocalifornia@mcclatchy.com. Let's keep the conversation going. Share your thoughts on valley fever in the comments below.